My name is Laura Campbell. I am in the LPN to BSN program. My nursing background is mainly in corrections and peds, which sound like two very different ends of the spectrum, but it's really not. I am currently working. I'm working full-time as a pediatric private duty, as well as trying to help a corrections company with training whenever they pick up new facilities. I am a single mother of a 15-year-old boy, and I live within a 10-mile radius of all my immediate family, so it's a big help. I'm very thankful for that. My definition of professionalism, or being a professional in nursing, is maintaining professional boundaries and not letting your own feelings influence your care. In corrections as well as in pediatrics, you're faced with situations during private duty pediatrics. When you're in the home, you observe people who may have completely different parenting skills than you, or they may live their life a lot differently than you do, and it sometimes takes you aback, and you really have to stop and think about the reason that you're there. And in corrections, it's important that you don't let how you feel about the crimes that these individuals have committed influence the way that you see them, because at the end of the day, they're all somebody's son or father or brother, sister, mother. So it's really important for you to keep those boundaries and keep professional in your judgments to yourself. What led me to pursue my BSN? I've been at LPN for 10 years now. During one of my pediatric private duty cases, I learned so much from this 4-month-old baby, and the ripples that she made as such a small baby. She taught me so much, and it really propelled me to continue my education. And that was one of the hardest professional decisions I've ever had to make, was leaving that position with her so that I could go back to school. So anytime that I think, man, this is rough, I don't know if I can do this, I think, all that's for nothing. I left that job. That was my most favorite job I've ever had. I left that job for nothing if I stop now. Characteristics of a person that exhibits them as a leader. I always think about this meme that I saw once, and it had 2 different pictures, and it was a leader and a boss. And the boss was standing behind 5 other people who were working, trying to pull a boulder, and the boss was cracking a whip. And the leader was in front of the 5 other employees, and he was helping pull. I think that one of the most wonderful things about being a leader is being knowledgeable about all the different things that you're supposed to be supervising and educating on, because if you don't know that, how can you properly evaluate them if you don't know how to do it yourself? An example of a leader who displays the characteristics I discussed would be a nursing supervisor that I had in corrections. She could have stayed in her office all day long, and she could have done paperwork and done a lot of clerical things that she had access to that we didn't. But she always made sure that we always had everything that we needed. And when we were swamped, if we had a lot of people come in, she was really quick to step in and help us to make sure that we didn't get behind. No one was overwhelmed. It kept morale really high, and it really made us feel like we were appreciated. And how I've demonstrated professionalism in my practice as the LPN, I kind of touched on before, was just keeping those professional boundaries and not allowing any type of judgment into my practice. So when I'm in that correctional setting, I treat them as just humans, because that's what they are. I don't ever think about what they're there for. And when I'm in my pediatric private duty setting, I try to keep those same concepts to me, that, you know, their house may not be as clean as I like my house to be. Their parenting techniques may be different than mine, but that's not my child. That's not my house. So I have to respect my patient, respect my families. And I think that respect and leadership go hand in hand. I'm excited about this course. Thanks.